Good afternoon and welcome to the West Yorkshire Joint Health Overview Scrutiny Committee. We have apologies for absence from Councillor Scopes, Councillor Sandy Lay and Councillor Andy Soloway. I believe all of the members of the committee are here. Do members of the committee want to introduce themselves, please? So, Councillor Hutchinson.
Councillor Colin Hutchinson from Calderdale, Deputy Chair.
Councillor Rhodes.
Betty Rhodes from Wakefield.
Councillor Lawson.
Joe Lawson from Kirklees.
Councillor Timbers.
Hi, sorry about my camera, which seems to be dying.
It's all right.
So it's Jonathan from Calderdale.
Thank you. Councillor Jamil.
Good afternoon, everybody. Councillor Rizwana Jamil from Bradford.
Councillor Griffiths.
Hi, yes, Alan Griffiths, also for Bradford.
Councillor Nichols.
Hello, Andy Nichols, Wakefield.
And do we have Councillor Lee? No, we've put Councillor Lee as apologies then. Okay.
Sorry, yes, apologies from Councillor Lee, but I'm attending on behalf of North Yorkshire Council to take any actions away.
Yeah, okay. Thank you, Edward. Thank you. Right, okay. So minutes of the previous meeting then. The minutes of the previous meeting were held on the 10th of September. Does anybody have any items they wish to bring up before we agree the minutes of the previous meeting? Councillor Hutchinson?
Thank you, Chair. One of the recommendations under the neurodevelopmental assessments was that we were going to be receiving the waiting list figures and hopefully trends in those waiting lists, and also the criteria that were going to be used to determine complex needs. I'm not aware that we've received those.
No, I'm not aware we've received them either. So, Ian, we would like those by Tuesday of next week, please, for all those recommendations. Are there any other points on the minutes? No. Can we agree, the committee, can we agree the minutes? Yes.
Agree.
Yeah, thank you. Declarations of interest. Members are reminded if there are any declarations of disclosable pecuniary interests, those need to be made. Are there any interest to declare? No? Okay, thank you. If anything comes up during the meeting, please let us know. Deputations and petitions we haven't received. Oh, sorry, Councillor Hutchinson.
Yeah, it's not really pecuniary interests, but I am a fellow of the Royal College of Ophthalmology, a member of the British Medical Association, a member of Keep Our NHS Public, and of Doctors for the NHS. So those are other interests.
Okay, thank you. Deputations and petitions, we haven't received any deputations or petitions. So we'll move to item 5, proposed place provider partnerships. Ian, are you leading on this one for the ICB?
Yes.
Yes.
I mean, should I introduce who's here from?
Yes, please. If you can introduce who's here, and also if you could keep. We have read all the papers, okay, and we have a lot of questions, so we need time for those questions as well. Okay, Ian.
Okay, so let me just introduce colleagues from the ICB and wider sort of healthcare system who have joined us. So we've got Ruth Unwin here from Wakefield. Ruth, do you want to introduce yourself?
Yeah, good afternoon. My name is Ruth Unwin. I'm Director of Strategy in the Wakefield District Healthcare Partnership.
Yeah, and Mark Brooks from Swift.
Oh, yeah, I'm Mark Brooks, Chief Exec, South West Yorkshire Partnership, NHS Foundation Trust.
And Debbie Robinson from Calderdale.
Hi, I'm Debbie Robinson, and I am Director of Primary Care and Community Services in Calderdale for the ICB.
And Laura Ellis from the West Yorkshire team.
Hi, I'm Laura Ellis. I'm the ICB's Director of Corporate Affairs.
Okay, so I will keep this brief. Councillor Smage has requested. Sorry, I'm Ian Holmes, Director of Strategy and Partnerships and Deputy Chief Exec for the ICB. Maybe just a few words to try and set the context for this, and then keen to get into a conversation with you. So we've been working for some time as an ICB and with partners across the healthcare system to support the development and strengthen the development of closer collaboration between health and care provider organisations, so NHS organisations, primary care, community services, mental health trusts, local authority partners, voluntary and community sector partners. And this is work that we've been undertaking probably for the best part of the last year or so. This is in line with the 10-year plan from government and the ambitions to develop integrated neighbourhood healthcare, which is a important government priority. We believe that closer collaboration between providers is essential to deliver integrated services, and so this work has been to try and support the development of those closer provider collaborative models. The work that we're doing is to establish 5 place provider partnerships in each of the 5 places in West Yorkshire, so Bradford, Leeds, Calderdale, Kirklees, Wakefield. There is no intention to have a single place provider partnership across the Calderdale, Kirklees and Wakefield footprint. And the period that we're entering into now and the memorandums of understanding that you've got relate to a kind of a shadow period for 26-27. So there's no intention to formally establish anything in 26-27 or formally change the governance arrangements or contracting arrangements from the ICB. What we're trying to do is formalise this way of working between partners in place ahead of potentially more formal arrangements coming later down the track. As you know, these changes are happening at the same time as there's significant other changes happening in the health and care system. So as an ICB, we've been asked to reduce our running costs by 50%. And part of the work that we're doing is how we respond to that and become a strategic commissioner. Part of the model that we're consulting on as part of that is to establish what we're calling integrator teams. And there'll be 3 integrator teams, 1 for Leeds, 1 for Bradford, and a single integrator team serving the Calderdale, Kirklees and Wakefield footprint. That's purely because we can't have 5 integrator teams with the running cost reductions that we have to work within. But that integrator team in Calderdale, Kirklees and Wakefield will serve the 3 place provider partnerships. So we recognise this is quite a big change, and what it may eventually lead to is the ICB having a single contract with a place provider partnership rather than the numerous kind of fairly small scale contracts that we have with providers within those partnerships. This isn't about service change. This is about a way of contracting, commissioning for services with a provider partnership, but clearly it's quite a big change in terms of how we will organise and commission services in the future. So on that basis, we're really keen to have a conversation about the arrangements that we're looking to put in place for 26-27 and then what it might look like beyond 26-27. So I'll pause there. I don't know if any of my colleagues want to add anything that I might have missed there, or whether you want to open it straight up to questions and comments, Councillor Smage.
Right, okay. I take it nobody else from the ICB has anything to add at this moment in time then. Okay, so we will open it up for questions. Councillor Rhodes, you have some questions, don't you?
I just have a comment, Chair, if I may. Before we open it up, we have representatives here dedicated to the various areas, i.e. Bradford, Leeds and the 3 that are put together, who have been working on this particular issue. Following on from Ian's presentation, is it worth asking those representatives that are here to have anything if they have to add in terms of the report that we've had affecting their own area, their own patch?
Is that representatives of the Scrutiny Committee or representatives of the ICB, Councillor Rhodes?
Sorry, dear, I was following on from Ian, forgive me.
Right, okay.
It's representative of the ICB board members
yes,
present.
okay, all right. Ruth?
Yes, if that's okay. I think there are a couple of things that I would want to emphasise, and I think Ian has alluded to them in his sort of opening, and it is covered in the paper. But I guess the most important things from my point of view are, as Ian said, there will be one integrated team for Kirklees, Calderdale and Wakefield. That is purely about how the ICB organises its staff. It's not about how the staff of the ICB interface with the partner organisations. So all those staff in the Kirklees, Calderdale and Wakefield integrated team, some of them will have dedicated roles in Wakefield, and we will still have 3 place provider partnerships, one for Calderdale, one for Kirklees and one for Wakefield. So our relationships with the organisations in place don't change, and our responsibilities for the population don't change. I think the other thing I think it's also worth emphasising is that this is not, whilst it's new in terms of the legislation, this is not a new way of working for any of our partnerships. We have been working in this with this partnership approach, certainly in the Wakefield district, for 10 years at least. We've had some form of partnership arrangement underpinned by an MOU. More recently, since the ICB came in, there has been the Wakefield District Health and Care Partnership. And the change to a place provider partnership is actually an evolution of that rather than a massive change, because the council have been, the local authorities and the NHS providers have been very much at the table in all of those discussions. So whilst I can see the perspective that it is different because it's underpinned by legislation, it actually has been a way that we have been working towards for some considerable time, really.
I think that the evolution of this, I think we'd want to go into that in a little bit more detail, Ruth, and who has been at the table, which organisations have been at the table. I think we have some questions on that as well. This, yes, people have been working in partnership, but this is different. This is a different approach. And just before I move on to Councillor Hutchinson, I'd like to ask, you've got a place provider partnership decision flow chart in the papers. Hill Dickinson to undertake options appraisal on behalf of the sponsor group. I would like to know which organisations are in that sponsor group, please. Who can answer that from the ICB? Mark Brooks.
Well, I'm not from the ICB, but I can answer the question.
Thank you.
If that's okay. So the sponsors group consists of the chief executives of the 2 acute trusts across the CKW patch, Calderdale, Wakefield and Kirklees, so Calderdale Huddersfield Foundation Trust and Mid Yorkshire, and ourselves at Swift, and also the chief officers from each place, so from Wakefield, Kirklees and Calderdale. So 3 ICB representatives.
Right, I was going to say, so when you say 3 officers from place, you're talking about 3 ICB officers, not any officers from any council organisation in this sponsor group.
Correct.
Can I ask then, because it seems to be that there is a subcommittee of that sponsor group on governance. Can I ask then, that subcommittee on governance, which organisations have been involved in the subcommittee on governance, please? Ruth, is that you?
Yeah, so the subcommittee, the subcommittee on governance does include representation from the local authority. So specifically, it's the legal lead for Wakefield Council is part of that subcommittee on governance.
So just the legal lead from Wakefield?
Yes.
No other legal leads from any other, as a representative. And the ICB and the acute and the trusts on that governance subcommittee. Yes. Okay. All right.
Could I just add, if that's all right? The scrutiny officer from Calderdale is also present, I'm advised. Thank you.
Okay, all right. Right then, Councillor Hutchinson.
Yeah. On the flow chart that's there, there's various dates and a timeline for decisions to be taken at cabinet meetings forthcoming. I was wondering whether those dates still hold, because it's been suggested at Calderdale Council that they do not.
Who's going to answer that one from the ICB?
I think
Debbie?
Debbie's got a hand up, Councillor.
Debbie.
So no, they don't, Councillor Hutchinson. We will be having conversations with Cabinet and Health and Wellbeing Board after the election period. So the dates in the flow chart are unfortunately incorrect. Cabinet, however, has been briefed informally prior to this. So there have been local conversations, but not on a formal basis, which will take place after the elections.
Because I take the point that you're saying that this is a memorandum of understanding, but there's a clear intention that it'll morph into a more formal contract at the end of the year, and it is important that this process is subject to scrutiny through, before, well in advance of any such transition to a formal contract, because there is an awful lot that hangs on this.
From the ICB, Mark?
Yeah, I thought it might just be helpful just to give a bit of background about the sponsors group and context and why we established it and what it's doing, because I absolutely agree with what Councillor Hutchinson's just said. For us, actually, it's a huge change in any organisation. If, for argument's sake, in a year's time, having worked through a shadow process for 12 months, contracts are handed to a provider collaborative in a different format, then actually any organisation taking on that contract is going to want to understand the risk and the liability and what mitigations there are. So for very different reasons, we are conducting our own business case and due diligence to make sure it is an appropriate thing to do for our own organisations, and we're not unduly exposed to additional risk. So the reason the sponsor group was set up, just to be clear, was actually for the provider organisations who may or may not ultimately take on responsibility for these contracts, is to understand that level of risk and what the scrutinies would be for them. So I don't know if maybe there's a slight misunderstanding what the sponsors group has been set up for. I'm obviously not been partial to these conversations before, but that was our rationale as I guess as providers, to ensure that we could assure our own trust boards about the validity and the level of risk and the mitigations we'd have in place.
I think, thank you for that explanation. I think the word partnership is in question here, as to which partners are the most heavily involved and which are not. And yes, it is very concerning that it is started off in such a way. Councillor Lawson.
Thank you, Chair. Oh, sorry about that. Is following on a little bit about from what Liz has actually said, what involvement have Kirklees actually had and at what level?
So, do you want me to come in and answer that?
Yeah, Mark, yeah,
So,
the mouse just wouldn't get to me.
It's actually very heavy. So, I guess what we have specific to Kirklees, but this is replicated in each place, in effect, is what we call design groups. Steve Mawson is the leader of the councils on that, and Michelle Cross is on that. So that's actually where the bulk of the work is taking place and where the real input is within that design group. So, and I'd have to check my full details, but certainly Steve and Michelle are heavily engaged in that process.
Councillor Lawson, do you want to come back?
How often is this design group actually meeting?
I think it's monthly. I'm fairly certain it's monthly. I'd have to check. But yeah.
Sorry,
the reason I hesitate, I think we had a couple of specific meetings. I think there was 1 month we met twice, but it's typically monthly.
So the design group for Kirklees has only met twice?
No. It's met monthly since it was formed. Call it 6 months ago, roughly 6 months ago. But we've had more intense. One particular month we had a fairly intense meeting that took up a full morning face to face. Well, that's why I'm saying I think we had 1 month where there were 2 meetings rather than just one.
Okay, Councillor Lawson. Yeah, Councillor Hutchinson.
Can I seek a better understanding as to who can be partners within this collaborative? Reading from the Leeds one, it's fairly clear that it's statutory bodies that will form the partnership, because they have to find a way of working together, because they've each got their own statutory responsibilities and financial responsibilities and so merging those with those of other organisations will require a way of arranging it. I'd like to be clear whether there is the scope for any commercial organisation to be a partner in the local collaborative, in the design of there is always the risk that commercial influences will influence the design of care pathways, care delivery to match their preferred business model. I'd like to seek assurance that commercial organisations will not have a part in these place-based collaboratives.
Who can answer that from the ICB?
Mark. Like I said, I'm not from the ICB. I'm from a provider who could potentially be a host organisation. What I can say, this might feel a bit more like a politician's answer. In our draft, I guess, membership arrangements that we've identified, we have not got any commercial representation at all. What we do have are the providers, we have local authority, we have voluntary sector, we have the hospices, etc. But we've not even thought at this stage of even any commercial involvement.
But certainly it's not, as far as I can see, it's not ruled out by the terms of reference or the documents that I've seen. And I would hope that it can be formally ruled out in such documents, if that would give me a lot more confidence.
Okay, Councillor Lawson.
Sorry, that was an old hand.
Okay, thanks. Councillor Jamil.
Thank you, Chair. From as far as Bradford is concerned, just a couple of points and questions. I think the main thing which we feel in Bradford is the overall lack of clarity on decision making and how decisions will be made in these new structures. And what's also been flagged up as far as Bradford's concerned is in the new integrated teams, how the needs of children will be met. Obviously, we've got Children's Trust operating in Bradford, and we've got children with very complex needs. So that's something which has been raised as a concern. And there's also concerns around, we see gaps in mental health, learning disabilities and autism as well. We can see that being a concern as well. So some of these, and how is with the ICB and their very much reduced workforce, how is the capacity of the ICB in the proposed new structures to support the creation of these new PPPs? So these are all concerns we've got in Bradford.
Thank you. Who can address that from the partners? Ian Holmes.
Yeah, thank you, Councillor Jamil. So in terms of the ICB changes, we are required, as you know, to reduce our capacity by about 50%. So it's roughly from about just over 1,000 people to about 650. And in line with that, there is a much clearer direction from government that we become a strategic commissioning organisation. That's the language that's being used now. And what that means is that our model of delegation that we've currently got, where we delegate the majority of our resources to 5 place kind of commissioning sort of structures of the ICB, we can't run that way in the future because of capacity. Because we think this work is so important, supporting the development of these integrated models, we've dedicated about 120 people out of the 650 to work in these integrated teams, and their job is to support providers to work together to develop arrangements to work together to deliver these kind of integrated models of delivery. And eventually those staff may be transfer across to those provider collaboratives if and when they become ready to take that on. But that number of people working in those places and in integrated teams is a lot less than it is now, because it has to be, because we've got to take capacity out. And as a result of taking capacity out, we've had to consolidate functions at West Yorkshire. As part of the strategic commission organisation of the ICB, the focus on children will be within that, and it will be how we understand population needs and commission for services. In terms of decision making within the place provider partnership itself, I think that's what the MOU attempts to describe in terms of how it works in decision making. I think one of the principles that we're really trying to establish is that this needs to feel like a kind of a partnership of equals rather than a takeover by one partner over the others. And the way that we set our commissioning intentions as a strategic commissioning organisation will be to ensure that that's kind of built into how we contract and commission for those services.
Thank you. Can I just pick up on those points about partnership? I think it is really, really important that partnership starts from the start, not halfway through. And as far as equal voices, etc., the MOUs do not seem to have those equal voices. For example, the Kirklees MOU has a quorum of 3, and we have 3 trusts in that provider partnership. So in other words, 3 trusts can take decisions without anybody else being there. That is not partnership in anybody's book. Can I also pick up on what Councillor Jamil was saying about children's services? Where is SEND? Where is safeguarding? And can I also ask, where is children's hospices? Because the in-scope, I presume the in-scope services have been chosen by the sponsor group and not the whole of the partners in the provider partnership. We have adult hospices. Now, is that adult hospices across the whole of West Yorkshire or just adult hospices in Kirklees? And where is children's hospices? So there's several points there that I would like an answer to, please. Ruth?
Yes, I was going to come on to say something about the services in scope, because I think there's times when we're so close to this piece of work that we might not explain it very, very effectively. So in terms of the services that are in scope, there was a degree of discretion within the working groups, so not the sponsor group that Mark's referred to, but the working groups that he's referred to, which do include local authority and VCSE representation. That it was through that approach. So if I describe what happened in Wakefield, there are representatives of VCSE, local authority, the NHS providers and primary care and Health Watch. Collectively, we determined which services we believed should be in scope. And I think then the other thing which is really important to emphasise is the services in scope for Wakefield, if I use that as an example, is roughly £100 million worth of services, predominantly services which are provided in communities and will form part of the future neighbourhood model. The arrangements for acute contracts, so inpatient mental health services, arrangements for NHS acute services will be directly contracted by the ICB, and the decisions about those will be made by the ICB board, not through these local provider partnership arrangements. And then I think the other thing that we perhaps haven't made as clear as we could have done is that this is only about NHS funded services. So unless the working groups in the area and the local authority had agreed to delegate some local authority services into there, none of that is coming into the scope. It's only NHS funded services. So it's only about how NHS money flows into the NHS. So I think it's important just to kind of to emphasise that this is not about, at the moment, local authorities ceding any authority over services that are funded through the local authority. If in the future local authorities choose to do that, that will be a completely different process that we would need to go through to get to that point.
Children's hospices and the quorum. Can I have an answer, please? Ian?
I don't think there is an intention that children's hospices will form part of these place provider partnerships, and I think the contracting arrangements for that will continue to be at West Yorkshire level. I think adult hospices are different, and they will be included as part of this.
But what you're saying is, because adult hospices are in the Kirklees MOU, then the Kirklees place has will recommend for the whole of the adult hospices across West Yorkshire, or just within Kirklees?
If I can just come in on that, because I couldn't speak for children's hospices because we don't have one in our district, but hospice services, adult hospice services are commissioned locally. The children's hospice services are commissioned across West Yorkshire, so they're part of a different arrangement. And then if I just pick up on the issue about quorum, I think that point that you make, Councillor Smage, is probably something that had escaped us in terms of the number. Does mean that it could be decisions purely made by NHS providers on those place provider partnerships. So certainly in terms of quorum, I think that's something that we could look at, whether we increase that or whether we are more specific about the diversity of representation, as we have been in our place provider committees. In our existing committee arrangements, we've said it must be at least one of local authority or NHS. We've been more specific about it. So I think that is something that that we can quite easily address if that's a particular concern.
Well, there is a lot of concern, but that is one particular concern, that in Kirklees 3 trusts can take a decision. And that is a particular concern. Councillor Rhodes, I'm sorry, you've been waiting patiently.
No trouble at all, Chair. No trouble. I've actually sat back here and listened intently to the answers that's come forward. And first of all, can I say, having been a long member of Scrutiny, along with you, Councillor Smage, over the years, we have seen movement and we have seen change. But I have to echo your views on how this has not been a partnership with anybody other than the people who were making up the decisions, because it's come to a decision now, or could have been in terms of the timescale, which is far from how partners should be involved. And I don't think that the governance arrangements, and I don't think that the involvement in terms of the democracy of local authority and the membership and the need for that has even been considered. Having said that, can I also echo Councillor Hutchinson's, because my initial concern as well is the issue of the scope for services outside of the hospital. And could this result in hospital-based acute services like planned care, for instance, mental health, ambulance services becoming under the remit of a joint committee? And this was something that years ago, you may remember, there was an accountable care organisation format. So the similarity is the same. So I'm glad that Councillor Hutchinson has brought up concerns about services outside being a domination in actually presenting them in terms of outside influences. I think in terms of what I've listened to, there are issues again about the organisational, how will the organisations receive annual capitated budgets, for instance, to deliver the contractors' agreed services? Will the proposals combine multiple services to one contract? Because when you've got 3 in 1 in Wakefield, as we have with Kirklees and Calderdale, that's 3 in 1. Whereas opposed to Leeds and Bradford, and they have the single organisational. And will there be a sort of that potential risk when we're looking at those organisational changes as the outside providers having any influence? And I've looked as well with the issue and the role of GPs within it. Is the proposed model then something that we could concern ourselves about? A GP's independence and accountability. The other one is when we're looking at budgets as they were dealt with in the past and the capitated method for the future, how will any savings out of those budgets be determined to who and to where in terms of service delivery? And will there be any possibility of individual providers within certain areas just retaining it as an issue of theirs rather than across the contractual obligations of 3 working together? I know it's a lot of issues, but they all come up in terms of what's happened today. I do believe that the answers that have been given up to press, to the questions that have been asked in general, are afterthoughts for people to consider in what I believe has been a rushed process. Councillor Hutchinson has mentioned the dates that are in the document that we've got today. And at this late point, having had the opportunity over several meetings with representatives of the ICB, I feel that they have negated any kind of responsibility in considering an overview from our point of view. So there are questions about budgets, there are questions about outside influences, there are questions about the GPs in it, there are questions about the alliance, there are questions about one contract, is it for everybody? There are questions about receiving any kind of savings, how are they going to be contributed out to one or to others? I believe the documentation is totally unconnected with reality of a scheme like this, because locally, in the local place, over the period of time that I've been involved, and many more members here, I was very happy to think at points that we were working towards the same intention of delivering the best for everybody. I'm not too sure that the way this has been put together in the framework, like you've mentioned, Chair, about these special groups and who's on them, and the, shall we say, the governance arrangement in reporting back to local authorities, that's something that we can address internally. But I have to say that where there's been meetings across the board, Kirklees, for instance, has, I'm told from this morning, from Joe, had 2 meetings to discuss things. Now, fragmentation is not the way forward when you're looking at a joint plan together. And I want to say this. I think, having read the report, and we've had another paper delivered to us today, I believe and understand that the majority of the context of this has been out there and been considered since last November. Even at last November as a date, it would have been, I think, respectful to consider how we collectively in the JOSC would have had time to ask all these questions. And I note within the questions that our representatives from the ICB today seem to have a little pause as to who was going to say what in answer to the questions that were asked. That doesn't instill me with confidence that there is joined up thinking, never mind being able to pause to decide who was going to give an answer. So there are lots of issues, Chair, that have been brought up this morning, and I will continue to listen to the answers. And may I say this, one thing I have noticed that's come along through all of the questions, including the partnership, which is totally at a loss to me, but I see that and I hear the word change, change, change. When I see change, can I refer back to the role of scrutiny in general? The word change means that organisations and responsibility is that when change is mentioned, that in itself should kick into place the value of scrutiny, and the value of scrutiny at a point where you have an overview, because as the chair said, at this point the questions still remain in a big circle that needs to be answered. And I'll leave it at that, Chair. If anybody can answer me without pausing to know what the answer is, I would really appreciate it.
Okay, thank you. Ian?
Thanks, Councillor Rhodes, and really trying to answer your questions as coherently as we can. Obviously, there's a few of us on the call, and we've been working on different aspects of this. I mean, the first thing I'd say is that all of the issues you're flagging, what will the contractual arrangements look like? How does the GP contract fit in with this? What do your your gain share, risk share arrangements look like? Those are all really, really good, relevant questions, and that's thinking that we're doing. That is not thinking that we're doing for April 2026, because in April 2026, we'll not be working in a way where we've got a contracting arrangement with this place provider partnership. That will be from April 2027 at the earliest. So that is work that we'll be looking to do over the next 12 to 14 months. And but it's absolutely critical, the points that you're raising, particularly what will the contractual form look like? How will we incentivise the right outcomes that we want through that? How do you deal with the the commercial aspects of this that you're describing? All really, really important points. And we don't want to rush it, and that's why we've got this step in 26 for 26-27, which is it's really a partnership agreement between organisations, but nothing's changing in terms of regulation or contracting for that year. It's we're working very much within the existing governance that we've got. I take your point around we could and should have been more forthcoming with scrutiny around some of this stuff. We've had conversations and private briefings over the last year around the wider changes, but I absolutely understand and respect the role of scrutiny within this. I think, like I say, because we've got 14 months before we even get to a point where we may have a contract, I think we've still got the time to do some of that work together in the future.
Well, thank you for that. Yeah. Thank you for that, Ian. Just a comment on that, Chair, if I may.
Absolutely.
I'm sorry, you seem to indicate that the pause was because you've had quite a few people doing pieces of work together. Obviously, you do that for a report, but shouldn't all of that have been ironed out before the report was sent out, where we have all these questions and queries? And I feel that the answer, Ian, I understand, but I feel the answer is that collectively together you've issued this report, and maybe there's been some blips in between. Now, I also do understand that the possibility still remains that there are several issues, and we've mentioned governance today. I also understand that there are some governance issues in terms of those bodies that have been mentioned here today. So just put that to one side until we have further discussion on governance, Ian. Thank you.
Thank you. Can I ask? There's been quite a bit of work in Leeds, as I understand it, and there's been funding for that, obviously. And there was a report put together that sort of showed a roadmap of how to get to a provider partnership, which involved all partners and included councils, included the officer process, the cabinet process, the elected members, etc., the scrutiny. But that roadmap that was sort of put together for Leeds does not seem to have been applied to this process for 3 other councils, and obviously Bradford as well. It doesn't seem to be applied for that. And I'd like to know why, when a memorandum of understanding seems to have been applied across the board, that a roadmap for getting there that gave time for everybody to talk about the processes, to discuss the contents, to discuss the transparency, to discuss how decisions are going to be made, etc. Why that hasn't applied in these cases? Who can answer me that?
Oh. Have we lost Councillor Smage?
We have, yes, Ian. Could we just hold for 2 minutes until we get Councillor Smage back? Would that be okay?
I'm here. Ian, sorry. I pressed the wrong button.
I mean, I think... So I guess the principle is we want to be using and sharing best practice. And I think different places have taken slightly different approaches to how they engage and work with partners in the development of this. If your view is that kind of Leeds model and the way that they're sort of describing the way that they'll bring partners together and take decisions is something that would be helpful, we can absolutely have a look at that through the governance group and look at the possibility of us adopting that. I don't know if Debbie wants to come
in. Debbie?
Yeah, I was going to say it all depends as well on the risk appetite of the people around the table in the place. So from a Calderdale perspective, they want to focus on services out of hospital. I think Leeds may be going slightly more ambitious. I don't know, I'm not close to it. But we are including GPs, we are including the local authority, they are around the design group, and they're going at the pace that they feel comfortable with. So 26, 27, so from April for them, there's still lots and lots of work to do, and there's still a lot of, in my book, opportunity for scrutiny to be involved, because the questions you are asking, providers are asking themselves, because they want, as Mark said earlier, to feel that they're in a strong and safe position before they actually really enter into any formal or legally binding relationship. So they are very much involved. The other thing that we do have is all 5 places, all 5 partnerships. I have undertaken an initial self-assessment based on the National Good Governance Institute framework. So they're identifying the gaps and the things that they need to work on. So that will help with some level of consistency. But the appetite and aspiration is at place. So just because somebody else is big and ambitious and wants everything...
No, that's fine. But what we're saying is that there should have been engagement a lot earlier than there is currently. And a lot of that should have already happened before any MOU got sent through a lot of that work as to how that memorandum of understanding was going to be made up, how the interactions were going to take place, etc., should have already been discussed. Excuse me. But when you say in place, I take it you mean in ICB place committees. And one of the concerns is that some of those place committees actually cease as of the 31st of March. According to some papers that we have seen. So the quality, finance and performance, transformation, all those committees cease as of the 31st of March in place. And so there's going to be quite a gap because your memorandum of understanding is talking about how to put quality, performance, etc. in place. And so there's a big gap. Councillor Hutchinson.
Yeah, I'm afraid I'm more confused now than I thought I was at the beginning of the meeting.
Yep.
I mean, to my mind, I'd anticipated that a large part of this is to redirect care from hospital-based to community-based. And yet we've been told that there's been no change, that the hospital activity will still be commissioned centrally from West Yorkshire ICB, and so will inpatient mental health care. Nothing will change as far as the council's sort of financial or other duties occur. How then are we going to be sort of putting in place the bones, the structures that will underpin a move from hospital activity to community activity? Or is that all going to happen magically in 14 months' time when contracts are signed? Darcy was very clear in his report that one of the barriers to redirecting work from hospital to community was the need to hardwire financial flows. It's very easy to measure a length of stay in hospital. It's very easy to know whether somebody has had an operation in hospital and for them to be paid accordingly. Community care and mental health are far harder to actually quantify, and to say what you've been doing with your budget and why you might need more of it. And that's why they've consistently lost out throughout the decades that people have been trying to redirect care from hospital to community. How is what is being proposed for the coming 12 months going to actually pave the way to that? And when are we going to actually see, when do you anticipate being able to provide the public and elected representatives with the understanding of how the longer term place-based organisations are going to work out?
Ian?
Yeah. Again, it's incredibly helpful question. So there's an end state versus a transition thing here, isn't there? And in 26-27, what we're saying is we're working with the existing sort of construct that we've been working in for a number of years. So place committees of the ICB will exist. They will hold individual contracts with different providers of services within those places. And we're asking providers to work more closely together during that period. But fundamentally, as you say, the financial flows and the real sort of drivers of change remain the same. What we have just agreed for 26-27 the next year is a set of plans which do invest more money in primary and community services than they do in other sectors. So 6.2% growth in primary and community care, I think an aggregate of about 2% growth in the hospital sector. So even though we're working within these separate contracting arrangements for this coming year, we've got a set of plans which do differentially invest in the primary and community care rather than hospital services. In end state, Councillor Hutchinson, I think the majority of the budgets that we get will flow through to these place provider partnerships. So the majority of the £6 billion, let's say, that we receive as an ICB will go to these provider partnerships, and that will include some hospital services, urgent emergency care kind of services, community services, primary care, some VCSE services. And the idea is that by having a single contracting arrangement for that and specifying the kind of the standards and the outcomes that we want associated with that, it will allow providers to work differently to invest in the right places. So you mentioned, I think end of life care was mentioned earlier. We know that we probably have more people dying in hospital than we'd ideally like, and perhaps less people dying in hospices in their own home than we'd ideally like. The financial flows, to the Darcy point, and the way that the system is regulated, make it harder to move the money than we'd ideally like it to be. And a big part of the reason why we're doing this is that if you give a group of providers a budget and the right set of outcomes and the right set of targets associated with that, they can work out between themselves about how best you deliver services across traditional organisational boundaries and in primary community settings. So that's the kind of the end state. 26, 27, and I keep making this point, is we're not really doing anything majorly different in terms of governance, funding flows, contracting. This is a kind of almost a partnership agreement between partners in place to work together in preparation for something more fundamental down the track. And as I've said, that is at least 14 months away.
Councillor Hutchinson, did you want to come back on that at all?
I mean, 14 months flies past, and that's my concern is that the scrutiny board in 12 months' time will be faced with a more or less fait accompli unless we've got a good handle on what takes place over the next 12 months. And from the documents that have been provided, there seems to be little consideration given to how that scrutiny is going to take place, where the opportunities are for it. And there is no mention for the shadow committee meetings that are proposed as to whether the papers that are being submitted are going to be accessible to the public, whether the minutes are going to be accessible to the public, whether any of the meetings are going to be held in public, or be public meetings, whether there's any ability to input from deputations or other means. It's just totally silent on these matters.
Ian, did you want to come back on that?
I mean, it was just on the first point really, which is that we won't come back in 12 months' time with a solution and saying here's what it is. We'll find a way of working and engaging with you as sort of scrutiny, both at place level through the OSCs and at West Yorkshire arrangement over the period. So it feels like more of an ongoing partnership-y piece of work.
So what about transparency? Who can answer about transparency? Because these MOUs don't have anything in really about that, do they?
We'll ask the governance group around that. I guess what I'd say is that the decisions in place will continue to be taken by the place committees of the ICB, which will have meetings published. The formal decision making is still through the existing governance arrangement, so the papers will be published and that will be accessible to people. On the specific question about the shadow arrangements through the PPPs, we can take that back to the governance group.
Okay. You said before that it was all it was ICB funding that was part of this work, that was in scope. It was only ICB funding. But Better Care Fund, under Section 75 and etc., is in scope. And that is about both ICB and local authority commission services. So how does that work? Where do those decisions sit? Where does the risk of these decisions sit? Who holds that risk? And why is it that we've been told today that it's just ICB funds and yet there's Better Care Fund in there? Debbie? You're on mute, Debbie.
So I'm going to speak from a Calderdale perspective. So we're in close conversation, more or less weekly, in relation to the Better Care Fund. And we're talking about it in the NHS bit, the joint funded element, and then there's a statutory function element. So the aspiration is for all of it, but we have to go through the processes to work out what exactly will be in and what won't be, and work that through with Cabinet, because Cabinet would have to give permission, and Health and Wellbeing Board in Calderdale holds the ring on this. So we're working through this with the Director of Adult Services, and the conversation is very live. We meet in Calderdale every other week in relation to a design group. So all this stuff is working through and moving forward. But the aspiration is for it to be including, we've had conversations and challenge from NHS providers in relation to services that take place in the community but are commissioned and paid for by the local authority. So I think we'll get somewhere with that after the election. But the way they are saying to us is it depends on scope and aspiration and the fit, not putting something in for the sake of it. That's Calderdale. I'm not speaking for anybody else.
Ruth, did you want to speak for Wakefield?
Yeah, I did. I wanted to say it's exactly the same position in Wakefield. So it's been a recent discussion about whether or not the Better Care Fund could be included, but still very live discussion about what elements of Better Care Fund. So from an NHS point of view, the parts that are in the Better Care Fund, we would want to be under the auspices of the Place Provider Partnership. But until that's worked through, the current arrangements stand. So decisions about the Better Care Fund and the signing off of that is through the Health and Wellbeing Board. And if an alternative delegation is going to be made, that would have to come through the council's processes to arrive at that position.
And yet it sits there in scope in MOUs. Councillor Rhodes.
Thanks, Chair. I'm afraid as this goes on, I am more and more concerned about the lack of communication with Scrutiny. I am really, really at a loss to know why this conversation hasn't taken place over many months. And the opportunity to have it is another thing. I'm very pleased to hear about Calderdale and the communication level and the activities there. That should be the same delivery across the three, Kirklees, Wakefield and Calderdale. There should be no simple message. We all know that that's a mistake. But what we should have had, and I feel very aggrieved about this, and anybody who's responsible knows that Betty can take her shillelagh out at any time when she feels angry. Why, oh why, has that not been a formula that has been delivered with opportunity across all three of those authorities? Calderdale, Kirklees and Wakefield, being as we have been batched together, no problem with that. We're all well able to take after things in our own patch. But why, oh why, is the scale of a format being not the opportunity for everybody? Why, oh why, has it taken today to find out the work that's going on through the NHS in Calderdale, as opposed to the work that should have been the same formula for the other two areas? And I can't understand why. And therefore that really does put more confusion in my mind about how the format of this has been set out, the timescale that has been set out. And I've been just reading up on all the jargon in the report again. And it's all about areas of work undertaken to the scope and implications for existing local authorities, commissioning arrangements and options and plans for the joint local authorities, etc., etc., etc. That's part of the scope, but yet the basis on which this is the formula for everybody has been totally ignored, totally ignored. And I've also seen in this little paragraph there is mention about partners again. And it actually states, and it's in very broad red underlined as well. It actually states in here about any partner may withdraw from the agreement by giving no less than 6 months' notice, written notice, to each of the other partners' representatives. A partner may be excluded from this agreement on notice from the other partners acting in consensus in the event of, quote, the termination of their services contract or an event of insolvency affecting them. Now, that in itself says a lot about contractual obligations or lack of them, in the way that that can be dismissed as a partner and in terms of the termination of the service contract. Now, that service contract forms the basis of delivery of services. So if somebody terminates the position on that board, who replaces it? Or is there a plan in place, a plan B, as I always like to say? Because if one or more decide that they terminated their place on these boards, then what does that say for the rest and the remaining that are there? And it just opens the door in my mind, as Colin has said, to this situation we find ourselves in today. And it then goes on to say about the implementation that Colin has mentioned and Ian has responded to. That basically what you're saying, Ian, in this 12 months in shadow, on a memorandum which is not legally binding, which leaves the door open for anybody in there to amend, change, or review through any contractual obligation, was going to be the basis of which you would move forward with a what shall I say, a bedded in approach as to how you were going to engage from 27 onwards. Well, I have to say, if this is the best anybody can do that we have received here today, I am sorely disappointed that there are so many questions in the air that are going to be dependent on 14 months of, I would say, ambiguity in a lot of this paper and report, that then leaves open the door for the risk element that Debbie has said. And I concur with Colin. The more we go on and we speak about it, the more concerned I am, Chair.
Yeah, me too. Absolutely. Ian, do you want to come back?
I mean, on the consistency point, I think the kind of the process that we saw. So in end state, we will need to get to a consistent point across the 5 place provider partnerships clearly, and there'll be an expectation that the ICB commissions for a consistent set of services across the 5. I think we were a bit more relaxed about the starting point because we recognise that this is a sort of a it's an MOU between partners for how they want to collaborate on certain areas. I think what we need to do and what we can do and what we should do is set out more clearly that end state around what we think would be within these place provider partnerships versus what might be contracted on a different arrangement at West Yorkshire level. I think that would probably help all of us. I think the provisions around what if somebody leaves and doesn't want to be part of it. I mean, we have cases where general practices lose their contract, for example, for quality reasons or whatever that might be. And it's just to allow for those kind of eventualities. I don't think there's an expectation that the partners will be coming in and out of this. I think it was just to allow for that eventuality.
So you have a plan B in place then, have you, Ian?
Well, in the same way that if a practice in West Yorkshire stopped providing services, we would have a plan in place to recommission that activity elsewhere. It's that same kind of principle, I think, Councillor Rhodes.
Thank you, Ian. Can I follow on with just another concern that I have, and it just needs saying as to the position as we go forward. I appreciate this is all within the 10-year plan and directing services to community-based services. That's a good thing. Now, my recollection of the present structure, Ian, was you have a main ICB board, and underneath that board, I recall from our shadow position before it became formal, that underneath that board you had an organisation called SOGA. Yeah. And they were the decision or the management level of the organisation who then reported back to the main board. Now, what is the place and position of that as a structure within the future, Ian?
Yeah, so we've got a set of committees now and a set of which are committees at West Yorkshire level, which include finance and performance, quality, transformation, audit, and then a set of place committees, and they kind of manage the sort of the board delegates to those, and that manages the business of it. The SOAG, the System Oversight and Assurance Group, is an executive group, which is kind of not part of the formal board governance. It kind of relates to the Financial Investment and Performance Committee, which is the relevant committee that it sits under. The role of the System Oversight and Assurance Group was to do exactly that. It was to provide an oversight of performance, financial and operational performance of providers across the system. One of the features of the changes that were set out in the ICB blueprint is that ICBs will no longer have the same responsibilities for system performance and system finances that we currently have under the 2022 Act. So the idea is that the ICB becomes more of a traditional commissioner, and NHS England and the regions, the future regions of the Department of Health and Social Care, will take on that performance oversight role. But that is subject to legislation, and there is currently we need to work through the implications of that. My expectation is that if and when that system oversight role from the ICB is taken away from the ICB and given to the regions, then the System Oversight and Assurance Group arrangements that we had, Councillor Rhodes, will probably not make sense to have anymore, but this is subject to wider legislative change, I would say. Hopefully that answers your question.
It does indeed, because I recall how many people sat on that organisational level. So basically what you're saying, that could be something of a future change as well, Ian.
Yeah, I mean, I think the changes to ICBs, even though we'll retain the name, we expect an ICB, the changes compared to the 2022 legislation, compared to what we think is going to come out next year, is pretty fundamental. And a lot of our responsibilities around system oversight, system leadership, will be kind of transferred to the region, workforce, digital, things like that as well. And I think clearly, given the financial running cost reduction that we've got as well, we are not able to service the range of meetings and boards that we currently do as well. So we'll need to look to be really proportionate about that.
And lastly, Chair, I know you mentioned it, but in the broader context now, across these new incentives and organisations, I think there is a greater need in terms of the concerns of today that the membership of these are re-looked at in terms of the membership of local authority and their input and areas of concern and responsibility. I do note as well that the VCSE organisations in the place-based provider partnerships are part of both the decision-making, excuse me, and service delivery and design. Now, may I just point out that that's very welcome to have our voluntary organisations in all the things that we do out there. But I do always point out, as welcome as it is, they have to have a voice of reporting back, as we do to our organisations, which I think in some cases is missing. But I think these are all things for the future to be ironed out, not just to have a name and a place. It needs to be meaningful, Chair.
Yeah, and I would agree. And also, I would include public health in that, Councillor Rhodes, as well.
Yes.
I think they need far more of an input into this, especially when health inequalities is mentioned in various places. Yes.
Indeed, indeed.
I think they need far more of a voice. Yeah. Ian, did you want to come back on that?
Just to agree that if we're serious about improving outcomes and tackling inequalities, the VCSE are a critical partner in that, and we need to make sure that we've got both the appropriate safeguards for their roles in those partnerships, and as you're right, that they're captured by the kind of the sort of the overall reporting arrangements that we need to have as well, recognising that some of them are obviously very small, but I agree that's work that needs to be developed over the next year or so.
Councillor Hutchinson?
I mean, just picking up from where you were mentioning, Liz, about the place that public health plays in this. I mean, it's not been mentioned in any of the documents that I've seen. But if we're going to bring up a healthier generation of children, the place of the health visiting and vaccination and school nurses are all absolutely critical in this. Also, the drug and alcohol rehabilitation work that's done. I mean, we've been beating our head against a brick wall about dual diagnosis services within the mental health system. I mean, where are public health in this whole jigsaw? And the other piece of the jigsaw that I'm not clear about is that the jewel in the crown of the NHS, dental services. I mean, I would have thought those fit very well at a place level, but do they have a seat at the table?
Who wants to answer that? Ruth, you come in.
Yeah, I just wanted to say, and again, it's probably something that is in the articulation of it rather than the fact, is that we may not have been clear enough in the documentation, but public health absolutely are central to the delivery of the place provider partnerships. And certainly from a Wakefield perspective, the local authority representation is public health, adult services and children's services, irrespective of what contracts they have in the place provider partnership. They are absolutely essential to the decision making. I think dental, Ian will probably answer on, which is slightly different in the sense that it's not commissioned locally. So whilst we might have a perspective on what we would want from dental services, we would need to feed that back through the ICB around the decisioning and contracting for that.
I think there's different approaches, Ruth, to public health. I've got too many buttons I'm pressing here. I think there's different approaches, Ruth, to public health in these documents. Certainly, public health is a member of the Place Provider Shadow Committee in Wakefield, for example. But for other places, they can be attendees rather than members. And I think this again goes to, okay, so the points about how has this been designed and how it responds to place, etc. It is concerning that there isn't equity of representation in there. Councillor Timbers.
Yeah, you'll have to excuse me because I'm very new to this, and I've been listening very carefully to the discussion. I'm still struggling to see how the administrative arrangements, these transitional administrative arrangements, will end up with services that are more local and which tackle health inequalities by taking a more local and place-based approach. I would have thought that the first thing to do is to engage with people in communities and to see how those services can be altered and changed so that they can be on people's doorsteps. I mean, I do note that there's stuff in the papers about any reconfiguration requiring an impact assessment, and I will hold my hand up now and give a declaration of non-material interest because I work for the Equality and Human Rights Commission, and I am a regulator in my day job for the public sector equality duty. I'm just struggling to. It seems to be about largely about administrative matters and not about change. And perhaps you can make me understand things differently.
Yeah, Ian.
It's creating the incentives to allow providers to make that change, Councillor Timbers. So if you look at historic levels of spend in the NHS, we have everywhere, I would say, in the country in the NHS, it's been really difficult to move investment from one sector to another, and the planning processes and the funding processes that we are asked to follow around that make it really difficult. We think that by supporting providers to work more closely in partnership together, it gives them a better chance to integrate services, and by creating the right incentives through contracts to improve outcomes and to tackle inequalities, it incentivises them to work in a different way to do that. So if you just regulate an acute hospital to deliver A&E targets, to deliver 18 weeks and deliver financial balance, that's what they'll try their best to do, because that's what their board is set up to do. If the money that provider gets as part of a partnership has a much stronger focus on improving the outcomes that are really important in Bradford or Leeds or Kirklees, and tackling the inequalities that we know exist in those places, we believe that gives a better chance of responding to those things. So completely take the point that a lot of the conversation that we've had today has got into governance and contract and quoracy and things like that. But the end, I think it's really important, and this is, I think, what the 10-year plan tried to set out, is how do we, as a strategic commissioner, create the levers, incentives, drivers to tackle inequalities and improve outcomes. And that requires the ICB to work in different ways as a strategic commissioner, but it requires providers to come together in a different way to deliver services in the way that meets population's needs in their community. So it is one step removed, but that end is absolutely about tackling inequalities and improving outcomes and delivering services in a more integrated way. Again, I think that's something that we probably could set out more clearly as we come back here.
Councillor Timbers, did you have another point on that? Okay.
No,
yes?
not really.
No.
Sorry, I'm
okay.
struggling with.
All right. Okay.
I'm struggling.
Okay.
Struggling with.
Okay, that's fine. Thank you. Can I ask Ian, what happens as of the 1st of April of this year? So what we're saying is that not all partners in this partnership are likely to have their decision-making processes in place, etc. I think that's what we've been saying. And so what happens as of the 1st of April in relation to these place provider partnerships?
In formal governance terms and formal contracting terms, very little. I think because this is a shadow year, it would have been really nice to have these arrangements in place for the 1st of April. I don't think that's essential, given that it is a sort of a shadow arrangement. And as others have said, we want partners to be able to come to the table when they are ready and at a time that makes sense to them. So this is, as I keep saying, this shadow year is more about a way of working in preparation for something more fundamental. So I don't think the April the 1st is a particular concern, unless Mark or Ruth or others have a different view on that.
Okay, Councillor Rhodes.
Thanks again. Well, the last statement that you've just made, Ian, in terms of having views on it, that will certainly be down to the decision-making process of signing the memorandum or not, as the case may be. And that's up to elected members in local authorities. That's our democracy. And as Councillor Timbers said, the way that this is progressed in terms of the issues of embedding quality in the transitional year, I do have to say that there's a lot of assumptions in terms of how that's going to come about. For instance, the National Quality Board are setting out a forthcoming quality strategy. And obviously it sets out with that 4 parameters. There's 4 bullet points that are in the report. And that is quality planning, quality control, quality improvement, and quality assurance. Now, it's the next paragraph that is vital in terms of the transition period as well, because it also says that core responsibility for each function, and I quote, are being developed by regions, ICBs, and service providers. Once published, these will need to be reviewed and adapted for the place-based partnership to identify which could be developed from an ICB or to be a shared responsibility within the ICB. Now, that says to me that in terms of this next 14 months, the delivery of this national strategy on those points alone, which is all to do with service delivery, control, improvements, quality assurance, etc., quality planning, that in itself is a statement saying, well, there's going to be options in it and who's going to do what. Am I right in thinking that way forward, Ian, or is that just something in the written jargon that's come out that is so important that as of yet that's got a heck of a lot of work to do on those 4 bullet points towards leading towards the national strategy?
Yeah, I mean, I think, yeah. So I think the national quality strategy will be important, and I think responding to the roles and responsibilities within that, and that will become part of the legislation, I presume, as well, will be absolutely critical. What I'd say, Councillor Rhodes, is there's a lot of the pieces of the jigsaw before April 2027 that need to fall that aren't in place. This is a really good example of it. Another really good example of it, obviously, is that we haven't got legislation yet. The legislation that we're expecting April next year, and we will need to be really agile and respond to those things as they come down. You know, there will be a quality strategy that will set out expectations. We'll need to work through what that means in line with the sort of the system that we're establishing. The ICB currently has quality oversight arrangements in place, and those will continue until we are told otherwise. But I can't overemphasize really that there are so many moving parts in the system at the minute. There's guidance coming out on things like the ICB blueprint, the role of place provider partnerships, and those will continue, and it'll only be until I think we get legislation that everything will be nailed down. And that's why we need to be agile, and that's why we need to respond. I think the intention around this shadow year was to try and step into it in a way where we weren't actually doing anything sort of significant with the governance or financial flows to allow us to work in that way in shadow in preparation for that. There's a lot of work that we'll need to do and a lot of things that we'll need to respond to, and I think the quality strategy is a really good example of that.
Could I suggest, Chair, that the more we go on today, the more we're finding that there are issues on this pathway for 14 months, which I hope will not result in the same speedy actions that have taken place for the last year within the ICB boards and those that have been meeting. I do think that time is of the essence, but what I would say is this. Obviously, we're aware of the legislation, Ian, and the changes that are happening. But I do hope sincerely that no matter what, whenever that national strategy of delivering quality care, because this is what it's not about putting people in places to have headlines. It's about putting the points together to have a strategy of care that's delivered out of the hospital for the benefit of the community, as well as those that are in hospital through partners or whatever it may be. And it's so important that I think we can't make the same mistake again. We cannot make the same mistake again, that from an overview point of the role of scrutiny and how it's actually been not mirrored across the patches that are going to be place-based has been, I think, dereliction, total dereliction. There are lots of things to be ironed out from today, and time is not on our side. So, Chair, the next step forward, would we suggest, with your guidance, that from today, we just perhaps combine a list of answers to questions and outcomes that we've got in terms of the way forward, and at the same time, obviously the next step would be for this discussion that we've had today to be mirrored out there in the reports to the local placed ICBs.
Yes, I think so. I think the words we started with at the beginning, I think were yours, Councillor, was change.
Definitely.
And this is a very big change.
Yes.
I think the scrutiny committees need to have a full understanding of what the impact is on their areas. For instance, we've just been talking about quality. Well, how is that going to work in each area, as an example? And I think it is for each, at the minute, the building blocks for this change seem to be on very shaky ground. They need to be put in place with better foundations than they've currently got. And I think that it should be for each place committee then to discuss whether they feel that this is significant in relation to change. Yes. And I would ask as well if the feeling is of this committee, even though it's informal, what is the feeling of this committee from what we've heard so far, so that the place committees can have that in mind as they're having these discussions. But it is up to the place scrutiny committees, Councillor Rhodes, yeah?
Indeed. Thank you, Chair. Thank you for that.
Yeah. Councillor Hutchinson.
Thank you, Chair. Can I ask about information governance? The Calderdale paper says that there will be some anonymised information for population health management, and then non-anonymised information for casework within this structure. How much of this will be through the federated data platform that's run by Palantir, who have sort of a controversial background in their relationships with ICE in the United States and in Palestine, to mention just two areas. So there is, you'll be aware that the British Medical Association have raised their concerns about this. So how much is this will this take place on the federated data platform?
Ian, not political. Remember, we're not political.
So Palantir was a company that was procured through national procurement from NHS England, and it is responsible for developing the federated data platform, which I think in the fullness of time will kind of hold and process an awful lot of NHS data. I don't have a specific answer to your question in terms of from day one how much of it will be held through the FDP, Councillor Hutchinson. Apologies, I don't have that information. There is a clear direction of travel. I think with the expectation is that more data is held and managed through that federated data platform. So I think that's a fairly clear direction of travel.
Okay. And I also wondered about how we're going to assess whether this new structure is delivering the goods. What metrics are going to be? What are the thoughts on the metrics that are going to be to underpin our assessments as to whether it's actually achieving what we're hoping it will achieve? I mean, is it going to include the Office for National Statistics published yesterday or the day before figures which show that healthy life expectancy is at its lowest since they started measuring this in 2011, that it's heading south, which is obviously the combination of issues over a long period of time. Is healthy life expectancy going to be one of the things that's going to be measured? Are we looking at deaths from treatable causes, which also have worsened in particular areas? Are we going to be measuring people's ability to continue living in their own homes, people achieving their preferred place of death? There's lots of different ways that you can assess whether the overall health system is actually making life better for people, or whether we need to change tack on certain things. What's the current level of thinking as to how we're going to assess the benefits from these changes?
Yeah, thanks, Councillor Hutchinson. So in terms of outcomes, I think there's probably three overarching metrics that we'd look at. One is that you've mentioned is healthy life expectancy. I think in parallel with that, we'd want to understand life expectancy and inequalities in healthy life expectancy. So, you know, what's your life expectancy if you've got certain protected characteristics, because you know there are huge variation there. And our real hope and aspiration, I suppose, is through becoming a strategic commissioner, is that things like that are much more at the forefront of the contractual arrangements that we have with providers and these provider collaboratives. We know that access standards are really important to people. So waiting times for planned care, waiting times for A&E, accessibility of general practices, and so on and so forth. But alongside that, I believe that how we can introduce these measures that you're describing, including the inequalities around those, I think is one of the big opportunities we've got through these arrangements. I don't think those kind of things feature at all in contracts that exist currently, and you know, I think it would be a real step forward to start having more outcomes-based contracts that do balance the need to deliver operational standards with improved outcomes and tackle inequalities.
Okay, all right.
Chair,
yeah.
Okay, if I also ask, in the Calderdale documents, it talks about moves to single neighbourhood provider and multi-neighbourhood provider contracts. I wondered what the current situation is with these.
The current situation is that those don't. I mean, I think Debbie might want to come in. Those are contracts that were flagged as part of the 10-year plan. They don't exist currently. We will be keen to understand and explore what contractual arrangements are available for us to commission for services that deliver the improvements and the outcomes that I was describing.
It does suggest that those are going to be one of the sort of features that the place-based structures are going to be expected to grapple with.
Yep, and that's what the 10-year plan says.
Can I ask Ian? I just want to come back on the 1st of April, okay?
Yeah.
Because I know you've got a lot of change within your organisation itself. And you're changing the place-based committees as well as of the 1st of April, in that some of their subcommittees will not exist. Where will the decisions be taken as of the 1st of April? And where will the conversations be had between the ICB and the other partners as of the 1st of April?
So I don't know whether Laura might want to come in here too, but the place committees of the ICB will still exist, and those will bring together partners in places. Those subcommittees, places have determined themselves which subcommittees they think they don't need to do as separate subcommittees in the future, and the business can be wrapped up into the place committees. and again, that Councillor Smith, that is driven by the lower level of capacity that we've got to service those. So we're looking at how we can rationalise, consolidate, streamline those arrangements. But those place committees will absolutely exist throughout 26-27. That will be the place where the delegated budgets are managed by places, and where partners will come together in each of the places to have conversations about investment and performance within those places. I don't know if Laura wants to add anything.
Laura?
Yeah, thank you. Just to confirm what Ian has said, so the decisions that are taken by place committees now will absolutely be taken by place committees next year. There's no change to that. In terms of the subcommittee structure, each of the places actually does something different. So some of the place committees have, I think you referenced the three that Kirklees Place Committee have, some have none, and variance in between depending on how they've been set up. Because they are ICB, so each of the place committees is an ICB committee, and the subcommittees underneath, what we have done is looked at the entirety of our governance structure. So we do have what we call West Yorkshire Quality Committee, Finance Committee. There is significant duplication at the moment between the conversations that happen in those subcommittees and what happens at the West Yorkshire committees. So a lot of that conversation will continue to happen in the West Yorkshire level ones, and they will liaise into the place committees. Each of the place committees also has quality leadership and financial leadership, for example, to make sure that those perspectives are brought into discussions.
Okay, thank you. And can I also ask, in this, so the place committees, the contract will be held by the place committees. So the recommendations from the partnership will go to the place committees, and the contractual arrangements will be with the place committees, or will it be with the West Yorkshire Committee, and the contractual responsibilities will be purely with the West Yorkshire Committee?
In end state, the place committees will not exist, and there will be a contract between the ICB.
Oh no, I know that. I'm talking about within this 12 months. Yeah.
The contracts are basically the same as they are now. So sorry, Laura.
I was just going to say it's a delegated decision model, so it's not a contract with the place committees. The board delegates specifically to the place committees in terms of taking certain decisions, but there's not a contract involved in that.
No, so if there was a recommendation from the partnership to say there was a contract for some services that was coming up for renewal during this shadow form, and a recommendation from the partnership went to the place committee, as I think the governance for this shadow form is indicating. So the recommendation goes to the place committee take a decision, then so is the contractual responsibility wholly with the ICB during this shadow form, or is there any contractual responsibility for the partnerships at all?
No contractual responsibility for the PPPs in shadow form.
Yeah, so it is with at the West Yorkshire level, the contractual responsibility. Yes.
Yes,
okay.
And the place where decisions are taken is driven by the value of the overall contract. So some of that might be at a place committee, some of it might be at board level, some of it might be at a sort of an officer level, which is exactly the same as we do now as what we would do next year.
Okay. And so what happens if during this 12 months shadow form there is something that comes that needs a recommendation from the provider partnership, but that recommendation needs to go through partners' internal processes first. So, for instance, within the council, the cabinet, the scrutiny, and everything, before a partner can sign up to a recommendation to go for a decision at the West Yorkshire. What mechanisms are there in place for anything like that? Or
if
Ruth?
I can try and help, and it won't be any different to how it is now. So from a local authority perspective, the only financial element that is managed in a partnership way is the Better Care Fund, and that is done through the Health and Wellbeing Board, and that will continue unless the council makes a decision to delegate in a different way in the future to the committee that is responsible for the place provider partnership. But that is unlikely to be in this next year. In the current year, the Wakefield District Health and Care Partnership, as an example of one of those place committees, has no jurisdiction over anything other than NHS funds. So it doesn't make decisions about anything that require you to go back to the organisations to take it through their processes.
Okay. Well, yeah, okay. Can I then ask, has everybody asked the questions that they wish to ask? Yes.
I have a question, and it's following on from yours, Chair, if I may.
Yeah, absolutely.
What if, leading up to the 1st of April that you've mentioned, if any partner within that is not satisfied with the governance or any other element of this MOU going forward, what's the position then if one partner within it says, no, I'm not happy, this can't go ahead because I don't believe the X, Y, and Z is fully appraised or can be implemented at this stage? What would happen then, Ian?
I mean, there's no compulsion for partners to sign up to the MOU. I mean, I think what we'd hope is that there's a ongoing set of conversations and dialogues within the places through the arrangements that that have been described, so that concerns were being aired and there was a productive conversation about how best to address those. Fundamentally, if a partner says I want no part of this, then they don't have to be. I think in the context of what we're trying to achieve, which is a partnership of relevant partners to achieve better integration of services, I think that would be a shame. I'd like to think we could work through issues and concerns that folk had, but there is no compulsion.
So basically what you're saying, it doesn't matter if people have great concerns that everything hasn't been answered or their concerns have been supported to a degree, it will go ahead anyway.
No, what I think I'm saying is that we're really keen to hear from partners and to have a productive conversation around how we can make this work and respond accordingly. I think what I'm saying is that there's no, there's no compulsion, but if there's a set of partners within the partnership telling us that this isn't going to work for them, we absolutely want to listen to those concerns and address them.
But have you not done a round robin, as I call it, in terms of these kind of concerns or issues being brought up that we've expressed today before this report came out?
I don't think we've. I don't. I mean, firstly, this has been a really helpful conversation, and I think it gives us a lot of detail to work on, but also it gives us some food for thought about how we engage with you on this over the next year or so, because that is important. I don't think we've picked up any strong signals from partners that they're in a position where they aren't going to sign up to this once we iron out the kind of the specifics and the details. So I don't think anyone said to us we don't want to touch this with a barge pole, but clearly we want to develop an arrangement that partners can get behind and that the thing can work. I do feel like there have been conversations with other members of council. So, for example, Mark described Steve's role in the Kirklees arrangement, and there's been briefings with Health and Wellbeing Board chairs as well. But having the right conversations with all the right parts of the councils is something that's incredibly important.
It is indeed. Thank you for that, Ian.
Okay. I think it's important that the partnership is partnership, as we've said previously, and that it is built on good foundations for moving forward. And as I've said, at the moment, this doesn't feel like the foundations are as strong as they should be and as they could be. and that there needs to be far more work on this, including far more scrutiny work on this. And so we go back to the to what we have discussed today about far more engagement with councils, far more engagement with elected members, far more engagement with scrutiny, far more discussions on these memorandum of understandings and what they mean and what's involved, and the fact that are the right partners at the table, do they have the right voice in that, etc., etc. And it does feel a little bit as if it is a health design with the sort of the rest of us sort of added on, if you see what I mean. And it needs to be a design that fits for the whole health and care, health and social care landscape across all the places. I think it's important that. So can I ask members, it does feel like a very big change in the commissioning of services, and how do members of the committee feel on that particular area? Councillor Rhodes.
Thanks, Chair. Yes, I feel it is a huge change in terms of moving forward. And I understand that some things have to be addressed in terms of the 10-year plan. I won't repeat my words because I do think I'm very disappointed in how this has been presented. It's basically a fait accompli. And I think we have individually some discussions that we have to have as the Joint Scrutiny Committee. I think in terms of advocating the change, it does come under the rules of scrutiny. It is, and it's been discussed over and over again, and the word change has been mentioned. And I think it's important that that change element and the role of scrutiny to here today is actually addressed in our minutes, and the further work that needs to be done for that change to be addressed as the outcome of today, to be then brought forward to the local place scrutiny committees as soon as possible. After that then, Chair, I think on some of the issues of concern today, firstly, I would agree that that's the next step, or I would support that as the next step, just as one of the members today. I would also support in the interim that the major concerns we've had today, and that you've mentioned just a few of them, are actually picked up by Ian, by Ruth, and by Debbie, and perhaps from today to be looking forward as much as we can, having addressed this as a major change. It would really be helpful as soon as possible to have some of those issues, and I'm being conservative in a way in what I want to address this with, because I understand the volume of work. But I think in the meantime, between the next place scrutiny committees, if Ian, Ruth, and Debbie could actually come forward with some of those concerns that I'm sure can be forwarded to them as priorities to help us in the future to be able to move forward, Chair, because at this rate, I don't feel that we have every answer that is actually giving us some comfort.
I would agree, yes. I think we recommend that this goes to the local place scrutiny committees as soon as possible, and that information that we have discussed today is provided to those place committees as well. and that when the ICB representatives are going to those place committees, that they bear in mind the concerns that have been raised by us, so that they have some answers for those place committees when they get there as well. I think that's really important. And I also feel it's important that the West Yorkshire Joint Health continues to have a scrutiny role in the whole of the West Yorkshire perspective as well. Yes. Councillor Hutchinson, did you want to come in on this?
No, I agree with what's been said. I see this as a substantial change. I do see it as being a step on the way to something that it's been put forward as being pretty inevitable in a year's time, and there needs to be a lot of thought given in the intervening year to make sure that what does end up as a contractual obligation, that it's clear what it's intending to deliver, how it's intending to deliver, the transparency with which it operates as a public service funded through public funds, and that the appropriate level of accountability is nailed down. But understanding exactly what's included, what is excluded, how it all fits together into a workable solution, and how exactly one is going to address the statutory duties and financial accountability of each of the partners does need to be discussed openly and in a lot more detail.
Yeah, I agree, absolutely. Councillor Lawson, did you have anything you wanted to add at this point?
Only really to reiterate is some of the concerns that you've given, Councillor Smage. I do feel that this appears very rushed, very sort of last minute. There appears to be a lack of engagements with local authorities, and I do have concerns that is raised about who's actually going to be around the table as a full partner and not sort of attendees as well, which was actually raised, and one of them comes to mind is dentistry. You've also got sort of GPs and various things. There's a lot of different partners out there that need to be equal partners in my mind. But I'll leave it at that.
Yeah. And I think, Ian, as well, what you said about we need to understand what services will remain at our West Yorkshire level and what will either go now into this shadow or what could go into the shadow, into the partnership in the future. I think that's Councillor Jamil. Have you got anything from a Bradford perspective? Because I'm very conscious that we've been talking Calderdale, Kirklees and Wakefield, and so do you have anything from a Bradford perspective you want to add?
I think it's just what I raised at the beginning of the meeting in terms of, the lack of clarity in terms of decision making. I think that's our biggest concern. And also when, in the interim of these arrangements, where do we go when we do have questions or queries regarding any of the services? So I think the questions raised today in this committee by yourself and other members, we would also agree with a lot of what's been said, but we do realise that we are in a slightly different position to the other three authorities in that we are still retaining our place position, whereas the other three authorities are in a slightly different position in terms of where you're heading.
Okay, thank you. Yes, and I would agree. We need far more clarity. We do. So if we can take those as recommendations, then moving forward, if everybody's okay with that from the committee, can we? Obviously, the place committees will now. they'll meet and they will come to their recommendations as well. And can I therefore thank everybody who's been on the meeting today. Thank you very much for your time. Thank you.
Chair, could I just ask that the elected members have 5 minutes when
yes, absolutely.
after the meeting?
Yes,
thank you
fine.
so much.
Thank you. That concludes the meeting of the committee. Thank you.
All elected members present? Yes. Yes.
Just hang on a minute. Just let's double check that we are.
Do you want
are
officers
off.
to remain?
Yeah, that's okay. But
yeah.
Yolandi, are we broadcasting or are we off?
Matt, let me just double check. Just bear with me. No, not yet.